Equivalent of 52 million rand has been made available to help research for life-saving surgery on this continent in Africa. The money will be used for a new research program that will establish centers of research excellence in 4 countries across the continent. Well, let's find out more about this. Professor Bruce Bickard from UCT's Department of Anesthesia and Perioperative Medicine joins me now for that conversation. Prof, 52 million rand for an individual sounds like a lot, but in terms of the health systems and the kind of research that you do, it doesn't sound like much, but I imagine that it takes you some way. What does 52 million rand buy you by way of, engendering a sense of research excellence in surgery?
Thanks very much. Firstly, it's not 52 million rand for myself. It's 52 million rand for the group. So, as you said, 4 centers of excellence in Africa: South Africa, Uganda, Tanzania, and Ethiopia. We've got a large network that's been working on surgical outcomes in Africa, and to have adequate health, you need surgery. And surgery, we know, is not safe in Africa. And really, this is a recognition of the work the group's been doing, and now it's to help us focus on improving the quality of care for surgery in Africa.
And you say that surgery, we know, is not safe on this continent. I don't think many people are alive to just, what the figures look like. And I was looking at your statement a bit earlier on, and my jaw dropped in that the rate of people who die after surgery on this continent is twice the global average.
That's correct. That's obviously extremely concerning, and probably even more concerning is when you look at cesarean sections. Mothers are 50 times more likely to die following a cesarean section in Africa than in high-income countries. And we think children are probably in the region of 10 times more likely to die or higher. But what we've seen is that a lot of these deaths are occurring in the post-operative space, when patients develop complications, and then these complications lead to death. And really the funding is really to address predominantly that issue, is how can we make surgery safer, particularly for the patients, the high-risk patients who develop complications.
So how exactly will you do that? I mean, you've got these centers, as you say. One will be in Tanzania, another in Uganda, Ethiopia, and here in South Africa. What will they do in the post-operative environment specifically? Will you be training surgeons on the African continent? Will you have centers and hubs where people will be coming and going and learning some of these post-operative procedures and methods of managing the health of patients?
So the grant has got 4 research components, and it's for essential emergency and critical care. So strategies to provide emergency care in the post-op period, and then strategies for decreasing complications leading to death. So that's known as failure to rescue. So interventions to decrease that. Then the third component is maternal hemorrhage. We know that bleeding basically kills mothers in Africa. So there's a big component on that, on the pre-op, intra-op, and post-operative management to decrease bleeding. And then the fourth component is about data. It's about being able to link data, track what's going on with patients, risk adjust what the outcomes are, and then that means any quality improvement interventions, we can track them in real time, essentially.
I don't know how much you are able to share of the picture locally in South Africa. We have anecdotes that we hear from time to time from professionals in the space that talk about, the difficulties that they face, for instance, including the supervision of interns and ensuring that, they're taken through all of those procedures properly and in a way that's supervised within a conducive environment, but working under pressure of resources. puts the strain on some of these processes, and there's been a backlog in some instances of some of these procedures, especially the elective procedures during the COVID-19 situation. Just a broader picture of what we're dealing with in South Africa.
I think you raise extremely important points. Obviously, in South Africa, on a continental perspective, we're relatively well-resourced. But the reality is we don't meet the standards for, indicators for being able to provide safe and affordable surgery. So the volume of surgery we can provide is less than what's recommended for safe surgery for public health, essentially. And as you say, our resources are limited, particularly our human resources. And this means that a lot of surgery is happening in environments where we have insufficient numbers of anaesthetists, surgeons, and obstetricians, and that all basically relates into worse outcomes or low quality of care. So although our research is on a continental scale, the research is totally relevant to South Africa. And this is why this research is important, because in high-income countries, the concerns aren't about how do you provide quality of care with limited resources. And this is really what this research is about, is how can we take the resources we've got and make it safer for the surgical patient. And the last point probably which you raised, which is really important, is because of these limited resources, the patients present late. So, they should be getting surgery earlier. And the challenge is we've got to increase the volume of surgery. And if it's not safe now and we increase it like we should, it's going to become more unsafe. So this is really important.
All right, I've got to thank you and all of the best. It's important work that you will be undertaking with your colleagues in these 4 African countries, including South Africa, of course. That's Professor Bruce Bickard from UCT's Department of Anesthesia and Perioperative Medicine.